The other piece was that Clinic Lab AI had generated about 200, almost 300 leads for us. Kayla was able to generate, with very little experience in sales, about $200,000 worth of new sales for PSA.
Let's
So
go.
the process works.
Let's
Yeah,
go, Kayla.
absolutely, right?
Come on.
Thank you. Hello, everybody.
Good morning.
There's Kayla.
So I'd love to know from both you and Al, Al, if you could share a little bit as well, kind of like what your role is with Professional Smiles. And
Absolutely. My name is Al Da Silva. I am a fractional COO. My role is to lead and help lead the operations, the strategy, the sales, the marketing for Professional Smile Aesthetics. So I work very closely with Dr. Price and his team.
My name is Kayla. I'm the care coordinator and office manager here at Professional Smile Aesthetics. My role here is to basically manage the sales, the CRM, meet the KPIs, as well as just make sure that the infrastructure is running smoothly here.
I'd love to know from both of you, before we got started with AI, what was the big problem that the practice was dealing with?
I think was missed opportunities. You think about the general medical practice, the front desk is usually a challenge. So I think not only throughout the day as the team was, it's a small team. So that's another big issue. You have a small team. They are both trying to balance both the clinical work in the back and also the front desk. So a lot of calls, would come in and patients would try to leave messages, trying to get to those messages. But the challenge with that is the speed of the lead. A lot of times a patient is making a phone call, and the challenge that I heard from Dr. Price and Lauren was that a lot of those opportunities would be missed. And since
Right.
they were posting on Instagram and TikTok, and they were interacting with those potential prospects, and they would be calling the practice. And let's say they call on a Friday and afternoon. So the practice, a lot of times there was no coverage on Friday afternoon. So a lot of times those calls were being missed. So when the AI was introduced, we were starting picking up those calls, which was one of the great improvements that was done. However, there was still further opportunities for improvement in terms of creating a solution that would actually automatically document those leads and had a process to actually follow up on those leads. So those are some of the gaps that we were able to address. And collaboration with you, Sebastian, leveraging my knowledge of CRM, cosmetic care coordinated processes, we're able to kind of put our heads together and come up with a solution that did not only help PSA, but it potentially can help several practices like PSA, dental practice,
Right.
cosmetic practice, and so on and so forth.
Yeah, yeah. Having those systems is huge, right? To be able to capitalize on every opportunity and then actually have a way to consistently stay in touch with those people, right? Especially for higher ticket treatment plans, like with what Kayla works with. You have to be on top of these people, right? It's not just going to be delivered on a gold platter, and it's like that in any business. And so while AI can help with getting a lot more opportunities on the board, in the end of the day, it is up to the practice to actually make the conversion happen. And so that's why it has been great to have Kayla as a part of this process, and that's why having a patient coordinator in general is super, super important. So I would love to know, of course, more specifically, like what kind of results have you seen so far at Professional Smile Aesthetics to really reflect what we've done here and what this has done for the practice?
Yeah, absolutely. I mean, it's allowed for just a structured way of, knowing which patients to reach out to and when, as well as, the different categories of the stages which patients are in. It's very, very helpful, with new leads, quotes given, consults scheduled, as well as, actually winning the patients and being able to look back and see, what the patient paid or what the patient was interested in, or so that's very helpful. I feel like that's been the most helpful out of this program so far.
That's great. That's great.
Absolutely.
All right,
Talking about the numbers, Sebastian, if we can give a little numbers, so to give a
sure.
little context. So one of the challenges that we have, and I think this does not only apply to PSA, but several other cosmetic practices, is that a lot of time there's not an active re-engagement campaign that's happening with your own patients. So our first step was to select patients that have been to PSA and they had received the service. And then we created, in this instance, was the the cosmetic dental patient journey. And we actually create a list of what would be the next step in that particular patient's journey. And then I believe we had about 500 patients that we were able to identify that had received services from us, but we had not contacted them consistently. The other piece was that Clinic Lab AI had generated about 200, almost 300 leads for us. And one of the challenges, Sebastian, as you and I talked about Sales XR in terms of how we could deploy that in collaboration, Clinic Lab AI and the Silver Consulting solution with the Sales XR process, was like, how can we re-engage those prospects, and how could we actually engage the leads that Clinic Lab AI had helped generate through the
Right.
AI process,
Yeah.
and or re-engage or contact. Well, when we put that whole process together, we actually developed the CRM journey where the Clinic Lab AI was actually activating those calls, documenting, writing to the CRM, and we were actually able to generate in about 7 weeks about $1 million worth of lead value. So here's the beauty. Kayla was doing a great job actually documenting the value of each one of those opportunities. So those were opportunities for revenue, right? Before, those opportunities actually would be gone, or we would not have the opportunity to actually even quantify that. The next piece was Kayla doing a great job. This is her first sales job, but what she was able to have was a consistent process. So she went through a training program with me. I have 15 years worth of experience in cosmetic elective cases, type of procedures. So we're able to put a process, not only with the training for sales, but the training with the CRM. And Kayla was able to generate, with very little experience in sales, about $200,000 worth of new sales for PSA. So the process works. Yeah,
Let's go, Kayla.
absolutely, right?
Come on.
Thank you.
Yeah, absolutely.
Generating leads is one thing. Being able to create those opportunities on one hand is always going to be a good thing. But like I mentioned before, it's important to have some kind of system and process to be able to get these people to move forward, right? You have to have somebody on the front lines that's going to make that phone call and have the conversation with the patient, right? Because Kayla, if you didn't do anything with any of the leads that came through, like, we'd still be booking appointments, yes. But if you weren't actively still communicating with these people and pushing them through the sales process, I mean, do you think you would have been able to generate $200,000 in the last 3 months?
No, absolutely not.
So I think
Absolutely.
that's super important.
As she pulls it up, Sebastian, I think I want to piggyback on one thing you said. You mentioned systems and processes multiple times. I think one of the biggest things that I've seen in the past is when you put the people, the process, and the technology together working in tandem, you get the
Right.
kind of results that we achieved. The people, having somebody like Kayla with the right training, right? The systems and processes, all of these standard operating procedures that we took time to develop for the front desk all the way through the entire practice set Kayla up for success. And then with you, Sebastian, you already had an innovative solution with Clinic Lab, but you had the vision to say, hey, can we take that to the next level in terms of adding the CRM into? So that's where the technology came into. And like you mentioned to me, you said you hadn't seen much that process being done very well with the integration between the AI voice with the CRM. But man, I have been very impressed with Clinic Lab AI, how they were able to actually pull that off, and we were able to create this Sales XR solution for not only for medical professionals, but who knows, other industries as well.
Yeah. Yeah, it's huge, right? And it's the disconnect that a lot of people don't realize is happening, right? Like, people over rely on the technology, and while it does make things easier, like, I think in the practice, now that you have AI, like, you don't have to make all those phone calls that you had to make before to follow up with the patients, because they're just booked, which a lot of people may have a little bit of a disconnect there and think that that's just going to do all of the legwork. But when you put humans in the loop on top of this technology, like you mentioned, that's where the real money is made. That's how you're bringing in hundreds of thousands of dollars extra in just a few months, just because you know how to really create that synergy.
Absolutely.
Right.
Is this the CRM?
Okay, so
Now I can see it.
all right, here we go. So this is the dashboard. So our opportunity values at 1.2 million. Our new lead opportunity status is at 535 within the last 78 days. And our conversion is 218,000 within the last 78 days.
Let's go.
This is amazing.
Yeah.
Yeah.
This is awesome, Kayla. Congratulations. I tell you one thing, Sebastian, one thing we've been doing with Kayla is every week we are touching on one aspect of the sales process. And one of the things that we have been focusing on is that this is healthcare. I'm also a nurse, former healthcare administrator, and this is different than a regular sales process. What's beautiful about this process is that every single one of those opportunities is based on a patient or prospect needs. So we are not going to sell them a procedure that's not appropriate for them. So it's going to be a procedure that's going to be based on their goals. It's going to be based on what's best for them. Sometimes they come to us and they come with one idea, but then when they see Dr. Price and Dr. Price, our smile expert, actually meet with them and give them different options. And then Kayla is working directly with Dr. Price very closely. And she is understanding, talking with these patients and understanding their needs. So it's the beautiful part is that these are not just numbers, these are people that we are helping achieve their goals.
It's true.
Right. Yes.
You know, in 2.5 months is definitely not too bad. You know, could be worse, especially just getting started in sales. Al, you would have a better idea of really what the systems were like before we had the system of the AI and having a patient coordinator involved as well. If we didn't have AI, and if there were no patient coordinator, what do you think this would have looked like? Do you think that we would have been able to generate this kind of result without it?
I don't think so. I think the practice was when they brought me on, Dr. Price has a vision to build something really special with this PSA. So that's one of the reasons why I was excited about this project. But there was some clear challenges and some clear gaps that was happening. Not that the practice was a bad practice, nothing like that. It's like if you're a healthcare provider and there's always room to improve your service, your experience. So when Dr. Price brought me on, he was like, Al, how do we take this to a new level of performance? So that's where, there was gaps, some of the gaps that we had was in the front desk. There was also gaps in terms of not having that follow-up process. There was opportunities there. But what we've been able to do, Sebastian, was that in the very first month that we had seen this process in practice and we had developed a budget and goals, we are able to hit our target. So that was another piece, was that we had goals, but there was an opportunity to clarify those goals and improve those goals with systems and processes, like you said.
Absolutely. Yeah, it's true. It's true. You know, you have to have systems, and I feel like people in business these days, like they don't have robust systems like that. Kayla, I'd love to hear your take as well. Like, what your thoughts have been on having AI at the practice, really just overall, how it's been affecting you and your job and how it's been presenting opportunities to you as well.
Yeah, I mean, I find it very helpful that AI, whenever somebody's not able to get to the phone because we're busy with other patients, AI will pick up the phone, and even if it doesn't book the patient, it will make notes that we can follow up with. And that's something that, they would have, before maybe left a voicemail and we eventually would have gotten to it, but that's just made the process faster. Yeah, I mean, I've enjoyed it.
Okay, cool.
Absolutely. I just want to thank you, Sebastian, for your vision with Clinic Lab AI. I think we are solving a big problem in the marketplace for a lot of medical practices. And I think having, like you said, technology is not the final answer, but it can definitely augment your processes and provide that additional support. And also, it's designed not to replace, but to take your processes to the next level. So we did not let anybody go because we implemented the solution. But I can tell you that the satisfaction from our staff has also improved, Sebastian. I don't know if you knew that. I think this has allowed our dental assistants to be dental assistant, what they do best, which is helping patients on the back. And then when the clinic is really busy, it allows us to making sure that every phone call is answered, which is one of the biggest challenge that I've seen. Last week, I was just doing a test and I call a few medical practices, and it was 1 out of 5 practices that actually picked up the phone. And then the phone
Right.
went to voicemail, and the ability to have the phone answer and actually help the patient, that's so critical. So thank you for putting that together and your vision to partner with us with Sales XR as well to be able to provide the solutions to medical professionals.
Absolutely. Yeah, it's been incredible. And thank you guys for being so easy to work with as well. I know that we have things that come up, it's not perfect.
Absolutely.
It's always an improving product, and we want to make sure that it's doing the best for not only PSA but every other practice that we work with. So, I really do appreciate you guys for that. Kayla, you've been amazing when it comes to, giving me feedback on the things that you believe could be improved or the things that are already going well. And so that's always great. And of course, thank you guys for jumping on here and talking about your experience. It means a lot to hear that we're actually making a positive impact on the practice. And so, again, thank you guys so much.
Absolutely.
All right.
Thank you. I appreciate it.
Cool.
Thank you, Sebastian.
All right.